Tools for Easing COVID-19 Related Anxiety, Part 2. I am Dr. Samantha Morris, staff psychologist at Student Health and Wellness Mental Health. This is Part 2, where we're going to be taking some of the same concepts from Part 1, so thinking through anxiety in the time of COVID-19, but moving more into the cognitive skills that are part of cognitive behavioral therapy, or CBT, in hopes that those skills can be helpful to you. So if you haven't already taken a look at Part 1, I encourage you to do that, as these are sequential, and the link is right there below where you can find Part 1. So let's move into the cognitive skills. You may recognize this diagram. These are the three components of anxiety: thoughts, behaviors, and feelings. And as you remember, these are constantly interacting. In Part 2, right now, we're going to spend some time thinking about thoughts. So this is going to be identifying the thoughts that tend to go along with anxiety, and then learning skills to deal with those thoughts. What we will cover: first, why are thoughts important? So why are we spending so much time thinking about our thoughts? Next, cognitive restructuring. This is the specific skill to cognitive behavioral therapy, or CBT, that's directed at changing thoughts that contribute to anxiety. And then lastly, how do I apply cognitive skills to my life? So the first section, we're going to talk about why are thoughts important. This may be something you haven't considered much before, so hopefully the next few slides are informative and make you think a little differently. So we're going to start with thinking about why thoughts are important and why they're one of the main areas that we target when trying to work on anxiety. The reason for that is that thoughts really dictate our interpretation of our world. So events that happen, our environment, others, ourselves, thoughts are constantly running in the background and influencing the way that we react. So in this way, thoughts really shape our lives. The way that you think, the way that you kind of exist with yourself really has to do with these thoughts that are happening. An example of this would be someone who's standing on the 50th floor of a high-rise building. So someone who isn't afraid of heights, for example, might think, wow, this is so cool. I can see all the way out to the land beyond. This is a great view. I can see the people below me. They look tiny. Whereas someone who has a fear of heights, their thoughts might look really different. For example, they might be thinking, what if this building collapses? Or what if the glass of this window gives way and I fall to my death? That person's going to be feeling very different from the first person. They're going to be feeling incredibly anxious and as if they're in danger, whereas the first person is having the time of their life, right? And nothing has changed. They're both in the same position in the same building, but they're having different thoughts. So that's an example of how drastically thinking can change the way that we feel. And in this way, thoughts can be helpful or they can be unhelpful. So thoughts can help us to achieve the things that we want to, or feel good about ourselves, or feel good about our work, or they can be unhelpful in that they can kind of undermine our productivity or make us feel bad about ourselves. They're really quite powerful, which is why we're going to be focusing so much on them in this presentation. Don't believe everything you think. So I think this is a very important kind of mantra to remember in your mind. Often people accept their thoughts to be facts, right? I'm having the thought, so whatever is going on in my mind must be true. When in fact, our thoughts are just thoughts. They're just mental events that happen that have a lot more to do with other parts of our experience than actual fact or truth. So something to keep in mind: don't believe everything you think. Another really important part of addressing anxiety through targeting thoughts is this belief that we have the ability to change our thoughts. And part of this process is looking into what are the thought patterns that you have that might be contributing to feeling anxiety or stress. So are these patterns contributing to anxiety? And if so, we move into the skill that we're going to be talking about today, which is called cognitive restructuring. So next I'm going to talk about what cognitive restructuring looks like and the ways that it can be helpful for people now, during this difficult time that we're going through, and really at any period in your life when you're experiencing difficult thoughts. Okay, so what is cognitive restructuring? In this section, we're going to talk all about it, and hopefully you'll learn a lot as you go. So cognitive restructuring is a really important skill. I personally believe they should teach this skill just in everyday school because it's so important. So what cognitive restructuring is paying attention to thoughts and challenging unhealthy thought patterns. So there's a step-by-step process that people can go through to do cognitive restructuring. These are the steps here in front of you. So first, identifying that you're having a troublesome thought. So whether that's an anxious thought, sometimes for other people that's a sad thought, any thought that's causing distress to you is one to kind of isolate. The next step after knowing that you're having that thought is labeling it. So we're going to move into what that looks like. The third step is challenging the thought. So this is the piece where you take the thought and you try to change it to something more helpful. And also goes into that is step 4, which is reframing. So your original thought is then reframed into a different thought. And the goal of all of this is to learn new patterns of thinking, new ways of seeing yourself, others, and the world that are more adaptive and more helpful. So next we're going to move through those steps one by one. So first step of cognitive restructuring is identifying the anxious thought. So this, we're talking about anxiety in this presentation, but it can really be identifying any thought that's causing distress. By identify, I mean we want to really get the thought out in front of you in some form. So that might mean writing it down so that you can see it, or recording yourself saying it so you can hear it. So it's really just about getting it out of your mind, isolating it as a single thought, and saying this is the thought that I'm going to go through this restructuring process on. So an example would be, someone is been in their home for weeks during quarantine, and they're having the thought, being stuck in my house for months is going to be completely miserable. So that's step number 1, just isolate the thought. The next step after identifying your anxious thought is labeling it. So what's nice about CBT is that it has these categories of anxious thoughts, and it can be really helpful just to be able to label the sort of thought that you're having. For many people, this helps to get it out of their mind and just say, like, I'm doing catastrophizing, or I'm doing all or nothing thinking. So you can see these here in front of you. These are some of the different categories of anxious thoughts. Worry is just those cycling thoughts that come back again and again, trying to prepare yourself for a bad thing you might think is coming. Catastrophizing is thinking about the worst case scenario. So maybe something small is happening and you go to the ultimate worst case scenario of what it could lead to. All or nothing thinking, that's also known as black and white thinking. So something is either all good or all bad. Probability overestimation is just what it sounds like. You're taking, small chance that something could happen and turning it into a larger chance that that thing could happen. So the example I gave in part 1 was, there's a small chance when you drive your car that you could get into an accident. Someone who is having these type of thoughts might think that every time they get in their car, they're in danger. Moving into some newer ones, should thoughts. So just look out for any statement you say to yourself that contains the word should. That's the way you identify those. And really, what these contain are kind of unfair expectations of yourself and others. So I should be keeping up with my work better. In that it's not a very compassionate statement, and it can be kind of self-degrading. So looking out for those should thoughts. Emotional reasoning. These are thoughts that actually begin with a feeling. So this is an example of how, in that triangle with the components of anxiety, feelings can really affect thoughts. So in emotional reasoning, someone has an emotion. So say someone feels anxiety or feels a sense of dread, and because of that thinks something bad is going to happen because of how they're feeling. So it's taking emotion as facts or proof that something bad is happening, when really emotions are just emotions. Discounting the positive. So this is when someone gives more weight to the negative of a situation than they do to the positive. So they're able to see that maybe there's some positive parts, but they discount those. All right, so moving back into the example that we had last slide. So if you remember, the thought that was isolated is being stuck in my house for months is going to be completely miserable. So if you were to label this thought, it can actually fall into a couple of these categories. It could be all or nothing thinking. So, it's either going to be miserable or it's going to be okay, but going with the extreme of miserable. And then also discounting the positive. So maybe being stuck at home is going to be difficult, but there's other factors too, like having more time with family, so that there's positives in there, and being able to give those a little more weight might be helpful. All right, so moving to the next step. Step 3 is challenge. So this is the point where you try and push back against the anxious thought that you're having. So rather than accepting it as being the only option and the only truth, you're going to start questioning it. So in this stage, I tell people to think about your thought as a hypothesis, and you have to prove that it's true. So that's where we have disputing questions. So these are other questions you bring in to try and get at whether or not the thought is accurate. And fact checking. So really think about things in terms of facts, and that can help ground people back into more accurate or more rational thinking. So an example of this process would be, okay, so we have the thought being stuck in my house for months is going to be completely miserable. So start asking yourself some questions. Do I know for sure that it will be months? Well, we don't. Has it really been miserable, or have there been good moments? So thinking through, each moment of the day, has it all been completely miserable, and trying to, shake that up a little bit. And then being able to come in with some facts that have happened. Okay, I have had more free time. That's something that's been true. And I have been connecting with friends in more meaningful ways. That's something that's also true. So again, you're just trying to kind of challenge that original thought a bit. Just open up other possibilities. And then the last step is reframe. So this is where you take everything that you gained and opened up in the challenge step, and you come up with an alternative thought. And hopefully this thought is reframed in a way that's more adaptive and more helpful. So what are other possibilities? What are alternative explanations for the way that you're thinking with the original thought? So the goals here are, you want to introduce doubt. So by that I mean you're just coming up with other options, other ways that you can think, so you have more choices about what to think. And believability will follow. So once you open up other choices, you may find that you maybe don't believe the new thought quite as strongly as you did the first. And that's really okay in the beginning. Believability comes with time. Remember that these are new thoughts. They're not thoughts that you're necessarily used to having. Whereas the original anxious thought came quite easily because it's the way that you're used to thinking. So we're just starting out here, and it's okay if you notice that in the beginning you can't quite convince yourself. It's more about just opening up other possibilities and options so that you at least have a choice of how to think. So the example here, so we were reframing the original thought, being stuck in my house for months is going to be completely miserable. And we've labeled it, challenged it, and the reframe will be, I do not know how long I'll be here, but I can try and find ways to make the time more enjoyable and purposeful. So that just feels a lot nicer than the first thought. Potentially this person would be feeling less anxious having that thought in their mind. I have a few more examples here just to help really familiarize the cognitive restructuring process. So another example is you have the thought, a lot of people I care about are going to die. So that's a really scary thought. thinking about anybody dying is a scary thought, but to think that it's going to affect a lot of people you know, of course, increases anxiety. So to label that thought worry, so you're worrying about the people you care about, and catastrophizing. Catastrophizing because you're thinking worst case scenario that you're going to know a lot of people who die. Challenge the thought, so come in with the facts, right? So do some research with some reputable sources. World Health Organization is a good example. From them, we know the statistics. 80% of people will have mild cases or recover from COVID without needing special medical treatment. So holding that thought in your mind, challenging the original thought, the reframe is, it's possible that I'll know someone who will die, which still is a scary thought. And from what we know, most people will recover and be okay. So letting that be reassuring, letting it bring down the anxiety, is just a more helpful thought than the original one. And I want to stress here, we talked about this in part one, but the goal is not to completely get rid of anxiety. We can't change the fact that we're in a pandemic and it's a scary time. It's just to really target these thoughts and think about ways of thinking that's more helpful during the difficult time. Another example. Thought is, I should be coping better with this. Why am I so anxious? And labeling, this is a should statement. Challenging, this is a global pandemic. It's normal to feel scared and anxious. Life changed drastically in a matter of weeks. So this is kind of bringing in the facts. This is a scary time, and we've all had to adjust a lot. So it's understandable to be anxious. Reframing, feeling anxious is a normal reaction to what is happening right now. So many things are uncertain. It's okay to feel this way, and it's okay to ask for help. So again, just comparing the first step there to the reframe just really changes the way a person thinks. And we're looking for thoughts to be more compassionate and more helpful rather than a person being hard on themselves. So that brings us to our final section of this part of the series, how to apply. So it's really going to go into how to apply these skills to your life, with the important point always that it takes time. One of the most important things to remember is that whatever thought patterns you have right now that are potentially contributing to anxiety, those have been around for a very long time. So if you think about it as, a route that you've run every day of your life, you're going to know that pretty well. It's going to be autopilot. You probably don't even have to think about it. It happens automatically. So those are the thoughts that you have currently. And to change that route, to change direction, it takes a lot more work. And it has to be very intentional in the beginning. You have to be very aware, and you have to practice. So that's something to remember. If anyone feels frustrated or that these skills aren't working right away, just remember you have to do it every day for quite a while, and you will see change. It just takes time. So again, how to apply it to your life, one step at a time. Thoughts take time to change, but the work is really worth it. So some just small steps to take little by little. Really just start noticing and writing down your thoughts. That's a really critical first step, because a lot of people really don't pay a lot of attention to thoughts. They just think of thoughts as being there in the background, and not something that's necessarily something we can modify. But it is. So this is just bringing awareness to thoughts. That's step number one. Then maybe try doing cognitive restructuring one time per day. So just, put a note somewhere to remind yourself, with one of my thoughts, I'm going to do the cognitive restructuring process, or with one situation. So one thing that comes up in the day, you're going to try to use this skill, and then really build from there. That's a great place to start. And the last point here that says relaxation first. So that's just a little troubleshooting tip. If you notice that, say in a crisis or a situation with high emotion, you're trying to use cognitive restructuring and you just can't do it. It's just not working. In that situation, emotions might be too high to do this skill. This takes some sort of reasoning and some pause in order to do. So I would say in that situation, first do some relaxation. So do something to calm your body down, do something to distract yourself for a bit until you feel in a little more of a centered place and can try this again. In the next section, we're going to talk about some behavioral skills. So we'll touch more on this relaxation piece. So that's all for part 2. I hope that cognitive restructuring is something that can be helpful to you. If you want to learn more about CBT, you can check out part 3, which is where we're going to be moving into the behavioral skills, again, drawn from CBT, and ways that behavior modification can help during this time or any time where you're feeling anxious.